there are multiple layers to the eye, and we've talked about the cornea and sclera earlier, but now there's also something called the choroid. So the choroid is located between the retina and the sclera. So the retina is the innermost layer of the eye, the sclera is the outermost, but the choroid is right in the middle. So this is what you see is all these blood vessels. So the blood vessel, the vascular area, the choroid is the major vascular area of the eye with all these small arteries, veins, and capillaries. Okay, so interesting thing is that this choroid also extends to form something called the ciliary body. So the ciliary body is actually, it projects out here and it has all these things. It kind of looks like a spider webs, right? So these are actually all these filaments that help to attach to something called the lens. So this is a suspensory ligaments and they hold this lens in place. This is another view of the ciliary muscle and body and the lens and ligaments. So notice that the ligaments are all arranged like spokes of a wheel with the lens in the middle. So the ciliary muscle, it can either relax or constrict. Now this is where it's a little tough, and if you don't get it the first time, don't worry, because I had to it's kind of counterintuitive at first, because you may think like constrict, therefore it's going to tighten. But in this case, this is where the ligaments come in handy. So with the ciliary muscle, when it constricts, what is it going to do? Well, when it constricts, it's going to actually cause more slack in this area right here. So when it has more slack, this makes it less loose, or makes it looser. Therefore, the lens is actually going to be less stretched out. If the ciliary muscle relaxes, it's going to increase in diameter. It's going to stretch these ligaments and the lens, and it's going to cause the lens to flatten and stretch out. So another way you can think about it is like if you've played a percussion or played drums, what happens when you draw the skin of the drum or increase the tension? It stretches things out, right? But if it gets looser, then it starts to, if you get whatever material is covering the drum or bongo or whatever you're using, and then relax it, then it's going to gather more toward the middle, right? So ciliary muscle is going to stretch or relax these ligaments, and this connects it to this lens over here. So the lens is hard, and if you did the dissection lab, you realize like, ooh, it's really hard to cut through this. You can cut through it, but it's very hard, and it actually has all these crystalline proteins. So the lens is a convex tissue, so that means it bulges out. And the cool thing about this convex tissue is that it bends light. Like I remember like maybe a few years ago, I saw this, and I think it was something ridiculous, like $100 for just a clear plastic ball, but acrylic ball. But what's happening here is that you can see it's taking the surrounding and kind of flipping it upside down and containing the entire landscape inside and projecting it inside that ball, right? So this is due to this convex shape. It's a spherical shape. So when something bulges out like that, it's going to focus all this diffused light into one point. So the curvature of this lens sharpens its focus. So what are you doing? Taking a broad area and concentrating it. So this is why I'm showing this example here. It's a great example of like how you're able to do that. Now, this is also why does this happen? It's due to a phenomenon called light refraction. So what is refraction? This is my non-physics definition, okay? So this is one whole, if you put a straw into a drink, you probably see refraction. It's just one straw, and pull it out, it's intact. But if you look at it from the side, it looks like it's broken. And why is that? Well, the thing is that the light is passing, over here, it's passing through glass and air over here. But here it's passing through glass, water and glass. There's no air. So air refracts differently than water. And how about this guy over here? I love this example. He's not decapitated, otherwise this pool would be all red over here. But it's showing you that light bends differently and it changes its direction, whether it's passing through a different substance or another. So the thing about when your light is passing through the air, yeah, it's passing through the air. But as it's entering your eye, it's going to pass through your cornea, it's going to pass through aqueous humor, it's going to pass through your lens, it's going to pass through the vitreous humor. So you're going to have this refraction. Now the lens is convex, so again, this convex is, compared to something that's completely flat, it means it's going to bulge out like this. This is convex, this is flat over here. So what convex lenses do is that they focus and concentrate light, just like that ball I showed earlier. Now concave is the opposite, and notice that compared to convex, which bulges outwards, concave bulges inwards toward the center of this object. So what's going, instead of concentrating light in the like the convex example, it's going to spread out light. So accommodation refers to a phenomenon where the lens changes shape to focus near or far objects. Sometimes you want to take in more from a wider area, or you want to take in less light from a closer object as well. So there's a condition called presbyopia, and this is a natural phenomenon. So if you have a loss of ability to accommodate and change the shape of your lens, then you might have a hard time focusing on things. Hopefully, especially if you're like in your 20s or just, if you're just a typical ecology student, you don't have this presbyopia. But if you notice that, like especially for your relatives who are nearing their 40s or 50s, they might end up doing this. And I remember like one of my friends, he still refuses to get free reading glasses, but yeah, he's in his 50s. And whenever we went to dinner or something, or if we went to like happy hour, he would always be like that. He would always do that. I'm like, you're embarrassing me. It's like, no. But yeah, it's like, dude, I was just like, dude, just get reading glasses. But he's like so vain, and he's like, yeah, he doesn't want to do that. But this is why when your eye is unable to focus, this is why he was doing that. He was trying to do manual focus by adjusting the distance of the object because his eyes and lens could no longer accommodate. So this is why it is, and the thing is that our lens naturally stiffens with age. So when we're young, it's flexible, it's clear, but our lens starts to change in terms of its properties as we age. So here we have an object, and we're trying to do a focus right here. So right now it's kind of blurry, but if we're able to round it out, what we can do around or flatten it, we can adjust the focus so it projects clearer on our retina. But if we have a lack of stiffness, or we have a lack of ability to accommodate and change the shape of our lens, then that's going to cause fuzzy images. So if our lens can't change shape, if you're like my friend, you have to adjust the object. But if you can't even adjust your distance to the object, then you need reading glasses. And another thing that can happen to your lens is not just stiffness, but also discoloration. So what we have with cataracts is that our lens starts to become less translucent and clear, and starts to get more opaque, hazier, and discolored. So with really severe cataracts, what we have is that the lens starts to get yellower and starts to get more opaque and fuzzy and hazy. So someone who has very severe cataracts might have trouble seeing things because, well, they can't see color in great resolution right now, and they have a very hazy appearance of the world. So again, cataracts is another consequence. Our lens ages. Thankfully, there is cataract surgery and lens surgery, so hopefully they have some, and it's really cool. There's actually a capsule of the lens, and they actually use this ultrasound probe, so these high frequency waves to kind of break apart the crystalline lens, and they insert artificial lens, and it's pretty, I know it's like looks painful, but for people who have severe cataracts, this really improves their quality of life. And nearsightedness and farsightedness. So remember that convex shape? Well, the thing is that let's rewind a bit. So emmetropia refers to normal, accurate vision. So 20/20 vision, no defects, no focus changes in accommodation. If you have myopia, or commonly called nearsightedness, you have defective vision of distant objects. Like I have that. So if I don't have contact lenses or glasses, that means I can read things. But if I'm trying to like read traffic signs without glasses or visual aids, I can't read it. It's all a blur. But if you have hyperopia, like say you might be able to play things like distance sports like archery or golf, but reading things up close, you might be like, oh, I need glasses for that, because you're able to focus on far things but not near objects. But instead of a lens problem, what happens with emmetropia, myopia, and hyperopia is that emmetropia, this is what normal vision should look like. So your lens, your overall shape of your eye and your lens should be able to focus things to a sharp focus on your retina. Now with myopia, notice that the eye is a little more squished and elongated anterior posterior. So what's that going to do is that, or in the hyperopia, notice that the distance is a little shorter, so it's kind of squished a little more and narrower and skinnier anterior to posterior. So with myopia, what's that going to do to light refraction? Well, you have refraction through the cornea and the lens, but with myopia, the focus is a little more anterior, so it's not right on the retina. So since the focus is over here, what happens is that this light continues its path, and then when it actually hits the retina, it's not going to be as focused. Whereas in hyperopia, what happens is that you run out of room. So you don't actually have that focus in front. The focus would be back here, but you already hit your retina. So this is why in myopia and hyperopia, you have a lack of focus and that fuzzy, hazy vision.